how do you choose treatment strategy in Colourpuncture if you're only beginning? Now imagine you took all your professional training. It's a lot of information. You tried something already on people, you tried something on yourself, probably on relatives, family, friends. And here you go, you start in your own clinic, your Colourpuncture therapist. What do you do? How do you choose this treatment strategy? I would like to break down this question into parts. Part one is how to choose overall treatment strategy in terms of where to start with that. And in a second part, I'll answer a question, how do you actually choose treatment on the day, on any particular day? How do you choose where to start with your treatment strategy? So somebody comes in, a new person comes in. First thing you can do is you can run all your diagnostic. Now, when I'm saying run all of your diagnostic, it's a bit extreme because in Colourpuncture we have a lot of options. We have finger testing, we have testing on the forehead, we have testing on the back, we have testing on the feet, we have multitude of options in diagnostic. And of course, if you're already a practitioner of some other therapy, for example, you're acupuncturist and you will rely on your pulse diagnostic and tongue diagnostic, or you're a reflexologist and you will rely on your reflex zone diagnostic, and so on. So if you just assume that you just know Colourpuncture diagnostic. So what you can do on the very first meeting, you can run fingertip diagnostic. Remember fingertip diagnostic, when we test sensitive points on fingertips, starting from the left, going into the right hand, and then we figure out which finger is the most sensitive, and this particular finger will relate to a particular meridian, and we start from there. And then we can basically devise our treatment strategy overall and on the day. And the second testing I would do probably on the first day is testing on the forehead. On the forehead, we can test 4 points, and then we can determine straight away which function circle or which of the elements of Chinese medicine and element of Greek medicine the patient is in at this moment of time, because this gives us direct entry into the problem. So for example, if there is pain or if there is inflammation, if there is energy stagnation in a particular meridian, then diagnostic of the forehead will give you entry to this on a higher level, on the level of the element itself. When we do the diagnostic on the fingertips, remember, our sensitive points, beginning or ending of meridians will be on our fingertips. So we again tapping into sensitive points. In terms of acupuncture, it's where energy in the meridian is very shallow. And so if there is sensitivity, it means that there is something happening right at the moment. However, speaking about finger diagnostic, we know that people tend to have the same finger sensitive over a period of time, and this is important also to understand, and this is something important to monitor and to record, and this is how you know what to choose. And straight away, when you do fingertip diagnostic, for example, you know that 2 fingers, they relate more to body level, 2 fingers relate more to spirit level, and 1 finger, middle finger, relate more to a soul level. So straight away you can give, this can give you indication into which level you're at. Is it endocrine, is it toxic, or is it degenerative energy pattern? And this already is a great help. And then of course, straight away you can tap into all your multitude of treatment options, which you know for each meridian, for each particular principle, and so on. So for example, this is the first session. You can choose either finger diagnostic or forehead diagnostic or both. I wouldn't rule out the patient straight away with multitude of diagnostic, because you still need to take your medical history. You need to talk to a person, and most of all, on the very first session, I would say just observe the patient, just try to establish some good contact, some good rapport with them. Try to feel into the energy field. Now, when I'm saying try to feel into energy field, it seems like I'm some kind of psychic or something. I'm not at all. I'm very, very far from it. However, because I was lucky enough to study with several great masters in terms of natural medicine, they all basically say the same thing. First of all, you need to really just feel into what this person is about. what they really need, what is going on for them. And this is something that you develop, and this is a bit of a catch-22 here. This is something that you develop with practice. When I started practice, I was fresh from science. I never worked with people. For me, that was something completely different and very difficult. But what I realized with time, that the more patients I see, the more I work, I developed this feeling for what it is that person needs. And with time, I came to a point where I don't really rely on diagnostic, because just by looking at the person, just observing them, how they talk, how they tell on the day, how they're feeling, I can see which treatments they need. But basically, this is the idea. So this is a place to start. You start with some diagnostic. Maybe on the second session, you can do diagnostic on the back, because diagnostic on the back requires patient to undress, so you can see their back. Diagnostic on fingertips and on a forehead doesn't require them to undress, so I think it's perfect for the first meeting. And then, of course, you can do your reflex zone on the foot diagnostic and so on. And this is, as I said, in Colourpuncture, you have a multitude of options.